Nigeria has been losing over 2,000 children below 5 years old and close to 150 women to birth-related complications on a daily basis. These figures account for more than 1 million deaths per year. That makes Nigeria only second after India as the biggest culprits when it comes to global infant and maternal deaths. It's a trend the government has been trying to reverse. IJ Edit is expecting her third child, and she's come here for her routine antenatal check, a practice that's gradually gaining currency among expectant mothers in Nigeria. She admits a lot has changed.
I have had to access antenatal care earlier. It used to be quite stressful. You have to wake up sometimes. You actually have to wake up 4, 5 a.m. to get on the queue on time to enable me have access on time and get back to work.
Latest figures from the World Bank shows that number has now been brought down to just under 1 million, and the country's health experts are seeking to do more.
It all bears down on preventable things. What are the causes of the maternal mortality rate? Commonly hemorrhages, malaria, infections. Those are the common causes, and these are things that are preventable. These are things that if adequate care is being given within a short period of time, these things can be ameliorated. So if you need to control your infant mortality, you have to work on your immunization coverage. That is one and most important factor. If we're able to get it right, there are statistics before now that we are getting 26% coverage of infant. That is unacceptable.
More than 70% of these deaths are linked to preventable or treatable diseases such as malaria, pneumonia, and HIV/AIDS. But access to health facilities in Nigeria remain extremely low. Presently, less than 20% of health facilities offer emergency obstetric care, and only 35% of deliveries are attended by skilled birth attendants. The country's Save a Million Lives project, aimed at improving infant and maternal mortality, recently got a boost of $500 million from the World Bank. But that too seems like a drop in the ocean for this very populous nation. And officials here think cultural practices too must change.
The most important factor in child survival is the educational level of the mother. If our mothers are still illiterate, they still feel it's a pride to give birth at home alone, and then you come out and say, I've given birth yesterday night, and then that is a pride to the society, then we have a long way to go. So the most important factor first is education.
One of the Millennium Development Goals was to reduce by 2/3 the under 5 mortality rates between 1990 and 2015. Nigeria is clearly falling short of achieving that target, as thousands of pregnant mothers in rural areas find it nearly impossible to access health facilities. Kelechi, Emekalam, CCTV, Abuja, Nigeria.